So as I mentioned a moment ago, if you or your child have a cold or flu-like symptoms, as we just described above, the specific ones relevant to COVID-19, but many of them are similar to a cold or flu, chances are it's likely you merely have a cold or flu. Don't rush to your doctor's office or to a hospital or to somewhere else to try and get tested at the first sign of a fever or a cough, unless your health is declining and you need urgent medical attention. So the recommendation would be, if you feel you are having the symptoms that I described above, relevant to fever, cough, shortness of breath, and they are not resolving, or you've been exposed to someone who you believe had COVID-19 or has COVID-19, then you should call your healthcare providers immediately or your local health department before seeking care. So in summary, call first. And then they can give you advice on what you should be doing at that point and how you should handle that, and whether you should come in or you should go somewhere else or you should stay at home, etc. So that is really important, and I want to make sure that everyone is clear on that, so that there isn't more concern and hysteria relevant to that. So currently, relevant to testing, there is no commercial RT-PCR, which is the kind of testing they would utilize, or immunoassay or cultural assay available for immediate testing yet. I've heard some rumors that there may be some coming out, but at present, they are not commercially available. So we would recommend that you contact local healthcare departments or the hospitals in your area if you feel that you need that and to be able to seek that. So they are trying to create more of these tests and make them more readily available, because there have been some issues relevant to that leading up to this point. But at present, it has been a little bit slow in coming. I did just read about some drive-through areas where that is available, not just in Korea, where I think many of us have probably heard that already, but here in the United States in addition. So hopefully that will continue to be rolled out into many more locations, or in some other way easily available and accessible to people. Also, related to prevention, there are no vaccines for COVID-19. So there is no available vaccine at present, and there are some candidates that they are trying to put together to be able to deal with this. But at present, there are none, and more than likely, it will be many months out, if not a year or more, before a vaccine actually gets fully developed, tested. They have put into various security measures, and then they figure out how they can roll that out in a uniform fashion for individuals who want that. We talked about how vaccines not available, and there is definitely some misinformation, and there's confusing information out there where some individuals are saying that they're beautiful and they're coming and they're readily available and they'll be out tomorrow and so forth, and that is just simply not the case. So I wanted to make sure to clarify that for everyone. Also, it is important to understand that the flu vaccine does not work for COVID-19. They are not the same. They are different. You cannot expect a flu vaccine, which by and large generally is not that effective anyway, to work for COVID-19. They do not have the same strands in there. They will not work for this. Now is probably not the time to be going out and doing that. Just a thought for you all. So let's talk about some things that you can do. Most importantly, we all know that washing your hands is super important. But I think what is missed for many individuals is it has become trite to say that we can just wash our hands and that that's going to be enough. But in fact, what we want to do is we want to do this really methodically and consistently throughout the day, many, many, many times. And we need to be thoughtful about when we're doing that before and after certain activities. So we're going to talk about some of that because that's really important to consider. And teaching you and your family members, your loved ones, children, and other adults or individuals who maybe are not able to wash their own hands and helping them with that process. You want to wash your hands under warm water. You want to get a big lather and you want to get between the fingers and you want to try and get all the way around and you want to get around the thumbs. And you want to make sure, and even if you have rings, to rotate the rings and to be able to make sure you get up and underneath those and be doing this for 20 to 30 seconds. So many of you might think that 20 to 30 seconds passes really quickly, but when you're washing your hands, it might not happen as quickly as you thought. And so what I would suggest you do is that you actually sing happy birthday and you sing it twice, and that may be a way to be able to get to that 20 or 30 seconds. But before you wash your hands, I'm going to recommend that you have a hand towel ready and available to you so that you can turn off the faucets with the hand towel. So let's follow through the path here. First, you're going to grab the hand towel, then you're going to have that set out and readily available to you. You're going to wash your hands thoroughly, 30 seconds, singing happy birthday, picking up the hand towel, and then you're going to turn off the water, and then you should be done. So that is one way to be able to go through this. You should consider washing your hands after each time that you may be touching surfaces or individuals for whom you may think have been exposed to COVID-19 as a mechanism of being able to rid yourself of that and dispelling any chance of you getting that. Okay. So the paper towel is really an important feature of that. Again, grab paper towel, wash hands, dry hands, turn off water, and then dispose of towel likely after you've walked out of the bathroom at this point. Also, wiping your phones. There's plenty of research indicating that phones are really dirty. And people use phones in lots of places where dirty things happen. And it is important that you clean your phones consistently. You might want to just check the manual for your phone as to what kinds of cleaners you can use for your phone, because some of them may alter the fingerprint sensor on the back of the phone. So you might want to check and make sure what you can use there. But it would be important to try and clean off your phone as best as possible regularly, since many of us have our phones in our hands at many points throughout the day. So cutting your fingernails, especially for women who may have longer nails, it'd be important to cut them so that they are relatively short, because dirt gets up and underneath there. And so we're really creating a space where we may harbor that bacteria or viruses in this instance up underneath the nails. So getting your nails short and cutting them regularly may be a very helpful thing to consider doing. And I know some of you might not be appreciative of that, but I would recommend that. Avoiding touching your eyes, nose, mouth, ears, any orifice in your body as much as possible. So considering that, if you need to touch your eyes, nose, mouth, or other orifices, I would recommend that you wash your hands first, then deal with whatever you need to deal with here, putting in a contact lens or flossing or whatever the process is that you're doing, and then maybe washing them again after that. Yes, that's a lot of washing, I understand. This is the best method that we know of to be able to help to avoid spreading and also getting viruses into our body. Circulating the air, keeping the air going regularly and consistency will be helpful, because if there's any reason that some of that virus has come out and is now dispersed and circulating in the air, if we're blowing that air out and we are turning it over regularly and consistently, it's less likely that you're going to be able to get any large volume or large number of droplets onto you. So opening the doors, opening the windows throughout the day and allowing for that air to turn over is a very healthy thing. Indoor air has been shown to be much more dirty, than the outdoor air. And so we want to use some fresh, clean outdoor air and consistently turning over your indoor air in spite of whatever that environment may be. There are sometimes where people work in offices where that's not possible to be able to do that. You don't have windows that you can open up, in which case there are some other mechanisms that you can deal with that. And we're going to talk a little bit more about that in a minute, but that may include utilizing some essential oils, which are known and shown and proven to be able to kill viruses. So that may be something that you could consider doing, disseminating that through a nebulizer or some other kind of disbursement method. Also utilizing ozone. Ozone is known to be able to kill bacteria, viruses, and pathogens. And so you can use an industrial size ozone generator in that environment to clean the air repeatedly. You just need to make sure that all 3 P's are gone: pets, people, and also your plants. These guys need to be out of there, because you will be changing that structure. And for anything that respires, plants also respire through their lungs, that we need to remove them while we're doing that procedure. Contact us if you'd like more information about that. We do have those devices here. We can assist you with that process. I am very well trained and knowledgeable on that topic, and I can assist you through that. So now the next one is using an alcohol-based sanitizer. These are really hard to get these days, so it may be challenging if you don't have that already. But what I want to assure you is using sanitizer is not as good as washing your hands. So first and foremost, you want to wash your hands and wash them regularly and consistently, as we just described. Hand sanitizer, in the absence of you having the ability to be able to wash your hands for 30 seconds, you can use a hand sanitizer, but it has to be 60% or greater of alcohol inside of that. And so you need to make sure that it is a potent one that you're utilizing. And again, if your hands are dirty and you're putting a hand sanitizer on, that is not cleaning your hands. It is just sanitizing the outermost surface, but you have not removed the dirt from your hands by doing this. So please don't get that mixed up. And I want to make sure that you're going to take best effort to try and clean your hands as much as possible. If you're sick, stay at home. We talked about this. Unless you really need urgent medical assistance, call first to determine what is the appropriate actions to take place. Cover your mouth if you're coughing. So if you need to cough, I suggest that you take a tissue and you cough into the tissue, and then dispose of this so that it goes away into ideally into a rubbish bin that has a liner, so that it can be properly disposed of. Okay. Second best thing is to sneeze or cough into your arm, but then you want to make sure that you're not hugging people or touching them with that same surface, because you would be spreading and dispersing it. Last option is to do it into your hands, and then immediately go and wash your hands, because otherwise you could be dispersing it yet again through your hands, so that would not be good. Keeping personal distance is an important thing. The recommendation is 6 feet. So if you think that you are infirm or someone around you is infirm, it would be wise to consider keeping a 6-foot distance between you and them, especially if you feel that they are coughing, sneezing, or obviously sick. Irrigating your nose is one of the best tips that we can provide you. And so our nose is really intended to be the filter for your body. That's the first filter for the air that we respire that you need to stay alive. And so irrigating this can be really, 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 I want to stress that, helpful. So there are a variety of ways to be able to do this. Probably the easiest and most valuable way to be able to do this is to have a neti pot. In utilizing the neti pot, this is basically, it looks like a little tea kettle if you're not familiar with it. And what you're going to do is you're going to put this nozzle into the nozzle into one nostril, and then you're going to allow it to come down and out the other nostril. Throughout that procedure, you're going to probably breathe in through your nose and try and get that solution all the way up into the cavity, up into your sinuses, and then let it come back down. And you're going to do this repeatedly, and then you're going to do it from the other side. So you can use something called Xlear, Xlear, and this includes in it grapefruit seed extract as well as xylitol, which has been shown to be antimicrobial, which can be really beneficial. Alternative to that, just use salt. Try not to use a table salt, that'll probably burn a little bit. Use like a rock salt or a Celtic salt or a sea salt or something of that nature that will have lots of minerals within it. You're going to let that dissolve in there, and then you're going to do this procedure. I would recommend you do that at least once, maybe twice a day. If you're sick, at least twice a day if you're feeling sick. And this will be one of the best mechanisms to be able to improve your health. We really do recommend that individuals do this regularly and repeatedly, especially in these times. Heat. So heating up your body is really important because actually COVID-19 is not heat resistant. And so you want to get your body temperature and your orifice temperature up to 80 or 80.7 specifically is the temperature, that's Fahrenheit, by the way, that you want to get it up to. So drinking hot or warm fluids, teas and waters and so forth can increase the temperature in your oral pharynx, and that will help to mitigate the capacity of any bacteria or viruses being able to grow or spread within that area. So if you happen to have breathed something in, drinking quickly some hot water can be really helpful and is another strategy that you can utilize. Using gloves, covering your hands, nitrite gloves. We do have some specific details on this document here that we can share with you if you request it from us at Optimized Wellness Center, and it talks about some of the specificity of the gloves that you can utilize. Surgical masks. So, we do have a variety of different kinds of masks that are helpful to be able to use, but this kind of a mask is not that one. Partly because it only goes over just your ears, but it does not really have an appropriate barrier. You want the ones that have two straps that go over the top of your head, and it's usually called an N95. And these will pick up the particulate, but also they'll keep anything on that surface there, and it gives you a respirator that comes out in addition. So it'd be important to make sure you access one of those if you really want to be well. There's lots of information out there indicating that we really stress and recommend not trying to hoard masks, but allowing for the healthcare individuals who are coming in contact with people that are sick to be able to have access to those, because in fact we've been hearing about shortages that have been occurring in a number of places. Also, it's pretty challenging, many of these masks, in that you need to really actually be throwing them away or turning them over every several hours or at least once a day. So most people don't have a stock hold to be able to do that, and they're wearing the mask repeatedly. So think about this. If by chance you got respiratory droplets onto the mask that you're wearing, and now you're breathing through this mask and it's creating a moist environment on that mask surface. And so now what's happening is that droplet is in that moist environment where it can now grow and spread, and you're breathing in and out over this surface repeatedly. Not a really great recipe. So we really would recommend not doing that. Again, you could wear a bandana or something else if you were washing or getting rid of these things repeatedly, if you were just concerned about the air and the environment that you're working or in. We do have some very specific instructions also about how to fit a mask to your face. It's called a fit test, and there's 5 different steps to this to be able to confirm for sure that you have the right size mask and it's fitted properly to your face. And so we can provide you the recommendations and the steps to go through that. So again, reach out to us and we can assist you with that. And so those are some other things that may be helpful for some individuals that really need that information to be safe, especially if they're taking care of individuals who are showing signs of being infirm. It would be important that they do that. Okay, so let's talk about some of the next things here. It's important that you also have a plan in place of how you would be reaching out to relatives and neighbors and family members that may be sick, and asking them and getting information from them about how they are and their concerns, and really talking to them and hearing them out, and trying to make sense of that and dispelling fears, but also listening to their concerns, whatever those may be, and trying to provide consistent resources and access to them. Also, it'd be important to talk with your family members, partners, parents, even with children. If you don't have a will in place, it is now the time to make sure that you have one in place. This is not meant to be morbid, but it's meant to be prepared. As we talked about, being prepared helps people to feel confident so that they don't get worried. Also consider writing a power of attorney. So if someone were to get ill and they were no longer able to manage their own faculties and make decisions, you would want to be able to have someone in place that you trust implicitly to be able to assist you in that process. And that's what a power of attorney can assist you with. And so considering getting that done would be an important set of steps to take for yourself and your any older individuals that you're related to, or neighbors, and maybe even for your family members. So how do you protect your family from COVID-19? So again, the vast majority of people will appear to have mild symptoms, especially children, for the most part, have done especially well. But we want to talk about how to reduce your susceptibility, and so some steps relevant to that. We did talk about some measures around washing your hands and gloves and that kind of stuff, and creating social distance and so forth. But infections and susceptibility equal symptoms. So the infection is spreading in various locations, as we talked about earlier, but we want to reduce our susceptibility because that isn't something that we can alter. And so that will reduce symptoms. So let's talk through what that looks like. Some of the ways that are really important to be able to do this is to deepen your connection with a higher spirit. Take some time to meditate and create connection, pray, and make sure that you are spending time creating and establishing and empowering that connection in whatever fashion you find is helpful for you. Getting enough sleep, 7 to 8 hours of sleep is what pretty much all adults need. That does not mean you're getting 4 or 5 hours during the week and then trying to catch up on the weekends. That is not how your body works. Your immune system does not respond that way. That is just simply not how it's going to work. So minimizing stress factors. So that may be working from home, individuals who make your life stressful, trying to avoid them, and staying hydrated. So our blood, which carries much of our immune system through white blood cells, and as well as red blood cells, is predominantly made up of hydration fluids, water. So we need to stay hydrated. This is not a time to get dehydrated. So I want to encourage each and every person to consider getting half of your body weight in ounces of water a day. For many of you, that may mean that you're going to the bathroom a lot initially. That'll give you a lot of opportunity to wash your hands, so that's great. I encourage you to do that. But that is really the recommendation, is that everyone is drinking half of their body weight in ounces of water a day. So I'm going to take a sip of water myself to make sure that I'm getting some of that in. Okay, associating with loved ones. Now that may be family, friends, neighbors, other individuals that are local or maybe even far away. Continuing to establish and maintain those relationships is really important. Exercising moderately, and so moderation is really important because exercise can also be a stressor. So I encourage you not to do heavy exercise routines at this point, because that could be an additional stressor onto your immune system, and that would mean that we would be increasing your susceptibility, as we talked about earlier. So again, infection susceptibility equals symptoms. So we don't want to increase that. But moderate exercise has been shown to actually boost your immune system. So there is a bell curve in some areas of moderation where that would occur, and you need to, if you need some help, contact us and we can assist you with defining where that is. So because we do actually have some measures of being able to determine how well your body's recovering. And we do that here at Optimized Wellness Center regularly and consistently. And so we can help you with that process to monitor that. Doing breathing exercises every day, pranayama, and we talk about here often what's called as diaphragmatic breathing all the way down into the bottom of your lungs, which is where the diaphragm is. We still have some specific techniques around that. If you'd like some assistance with that, please reach out to us. We can help you with that. And then utilizing our corona protection protocol that we're talking about here. So we're going to talk about some other measures here that you can employ today to try and keep you healthy and make sure that your family members are healthy as well. So looking for some additional natural resources and support for your immune system, well, we have you covered. We're going to help you in this process. So loading up on foods and spices that have antiviral properties. So these are things that maybe some of you know about these, but I would encourage you to make sure to stock up on them because these are the ones that are going to really help boost your immune system. Coconut oil, raw garlic, oregano, kimchi, ginger, fermented foods, walnuts, pomegranate, green teas, apple ciders, and medicinal mushrooms are many of the ones that could be really helpful for you, and I would encourage you to get those. Again, I have a list of these, so reach out to us and I can walk you through that. Bright, colorful fruits and vegetables, these tend to have high levels of antioxidants in them. Most people are sorely deficient in antioxidants. This is a really important conversation we have regularly here at Optimized Wellness Center is your antioxidant status. And I encourage each of you to come and find us here at Optimized Wellness Center or another individual who can help test your antioxidant status. We can do this non-invasively. Takes about 40 seconds, something like that. And we can know diagnostically exactly where you are and how well your body is absorbing the antioxidants that you're consuming. So there's a variety of reasons why potentially individuals may be deficient with antioxidants, and we can talk about the specifics of that, and that is important going forward. But in the immediate term, the most important thing is to get that antioxidant status back up to where it needs to be. So that means if you're not getting or absorbing enough through your diet, which the vast majority of individuals are not, I've tested thousands and thousands of individuals, we have data on millions of individuals, then you need to use supplementation as a mechanism to be able to boost that. And again, if you come into Optimized Wellness Center, we can test you to be certain whether you have enough, or if you don't, then we can help you to get those. We tend to use this product here. This is called Life Pack. This is a full multi-mineral, multi-antioxidant, and multivitamin. And it has all of these different things in here that will help you to fight oxidative stress. One of the things that we're learning, again, this is called Life Pack, and one of the things that we're learning about the COVID-19 is it thrives in an oxidative environment where there's a deficiency of antioxidants being able to fight this battle. And so individuals continue to get sicker and sicker. So having plenty of antioxidants will be helpful. Many of you have heard about utilizing high levels of vitamin C as a mechanism. That vitamin C is an antioxidant, and it's a very potent one, but it is not the only one. And so what I want to encourage is that we're getting a broad spectrum of antioxidants into the body, and we can assist you in that process. This utilizes a nanotechnology, which maybe you can see here. So it's instead of it being kind of glommed up little particles, we make it really small so you can absorb it much better. We can test it also and affirm that you're actually getting that absorption after you start on the product. So anyway, enough about that product. Red bell peppers, by the way, actually have exceptionally high amounts of antioxidants, even more so, about twice as much as many citrus fruits. So next things would be considering using some herbal remedies. We can talk to you about some of the specifics of that. Green tea is a really good one to consider utilizing, as well as flaxseed, citrus peel, orange peel, oregano, garlic, etc. And these tend to help destroy that 3CL, that protein that was being released by the COVID-19 that we talked about earlier. And so this can be really helpful trying to do that. So fermented foods is really helpful. Fermented foods can help to create an appropriate balance of probiotics, and these are the species that would be resident inside of your gut. And we want to have a diverse set of those so that we have slack in the system. And so getting a good amount of probiotics into the body and then prebiotics to feed those would be really important. We can talk to you about that. So you can consider some things like sauerkraut, pickles, miso, kefir, kombucha are all heavy and rich in probiotics, but sometimes, especially in instances like this, it may be helpful to have additional amounts of probiotics in using a supplementation, because there's some specific strands that can be really helpful, and we can assist you with that process as well. So reach out to us so that we can talk to you about that and provide those for you. We are offering discounts on all the supplements that we're selling these days to be able to help people in that process. And so we want to make sure that you're getting the right ones that are really highest quality, as well as not having any fillers or binders or other stuff in there, and that they're coming from labs where they're being third-party tested would be really important. So we can help you with strategies around that and getting you discounting on that, because it's important that you get those, in that price isn't the factor of resisting to get those. So we're going to talk about that.